Hi Lauren, I'm Jim.
Hi Jim.
I'm going to be treating you today. We're going to start off, we're going to do some pelvic tilts. So we're going to do posterior pelvic tilt. I want you to put your hands on your tummy right there. I'm going to put my hand underneath your low back. Now with this, I want you to tighten up your tummy and gently push down into my hand. Good, so you get a nice good abdominal contraction. Hold that for a count of 5. 1, 2, 3, 4, 5, and relax. Okay, so that's a posterior pelvic tilt. The next one we're going to do is not necessarily have you push down, but I want you to suck your belly button toward your spine. We're getting the transverse abdominis with that. Perfect, and hold that for 5. 1, 2, 3, 4, 5. Good. The next exercise is crunches. So I'm going to have you put your right hand under your head, left hand up toward the ceiling. Pick a spot on the ceiling above your right shoulder. So we're going to do a little diagonal here. And I only want you to clear your shoulder blades up. So I want you to come touch my hand. We're going to do 5 repetitions. 1, 2, good. 3, 4, 5. Now switch sides. Pick a spot on your right, above your right shoulder, and come up. 1, 2, 3, 4, 5. Excellent. Now with that one, did you feel that your back was pushing into the table more?
A little bit.
Okay, let's straighten out the legs. So this is going to give your back a little more hollow there. Okay, and let's put your right hand in under your head again. Left hand up. There you go. And come up. 1, 2, 3, 4, 5. Good. Other side. And 1, 2, 3, 4, 5. Perfect. Okay, felt okay with that?
Mm-hmm.
All right, now we're going to go in. That kind of emphasizes the upper abdominals as they insert into your rib cage. We're going to do lower abdominals right now. So I'm going to have you tighten up your tummy. Good. Good pressure into my hand underneath your back. I'm going to have you lift your right knee up to my hand and then slowly back down, and then the left knee up and slowly back down. So these are level 1. Keep going. We'll do a couple repetitions here.
Okay.
And tight, tight, tight. Good. Okay, that's level 1. You're doing great with that. Now we're going to go to level 2. I'm going to have you lift your right knee up, and you're maintaining great pressure against my hand. That's awesome. Now pick the left one up. Slowly lower the right foot back down to the table, and back up, and now the left foot down, and back up. That's level 2. Let's go level 3. Right leg down to the table, about 1 inch away. Slide out, maintaining the pressure against my hand. Come back. Excellent. Now the left leg down. And back down. Awesome. And relax. Give you a little breather. The next one we're going to do is a dead bug. Okay, so I'm going to have both hands up toward the ceiling and both legs bent. Okay, so this is the position of the dead bug. So we're going to hold that for 15 seconds, making sure you're keeping your tummy tight and there's no movement in the low back. Okay, we're going to go about 5 more seconds, and then we're going to go into the dying bug. Slow, controlled movements. Ready, go. Good. Slow, controlled. Keep that back flat against my hand. Good, we'll do that for a couple more seconds. Excellent. Good, very good. Let's roll you onto your hands and knees. Now in this position, we want, in the quadruped position, we want the knees right underneath the hips, so come up a little bit higher with this one. Good. Hands directly underneath the shoulders. And we're going to do the cat and the camel. So I'm going to have you let your back sag toward the table. Excellent. And then come up toward the ceiling like a mad cat at Halloween. And then back down and up. So this is the range of motion for the lumbopelvic area. Okay, now we're going to have you come down into a neutral spot. So come down just a little bit lower right here. So if we put a cup of water in your low back, that it wouldn't spill.
Okay.
Okay. Now from this position, we're going to go into the bird dogs. So I'm going to have you raise your right arm out in front of you and left leg and maintain this flat. So down just a tad. Perfect. And then hold that for 3 seconds. 1, 2, 3, and back down. Good. Now the other side. Good. Now tummy tight. So I'm going to touch you on your tummy. Good. Excellent. And back down. And we'll do 1 more each side. Tight. Good. And switch sides. Tight, tight, tight. Excellent. Good job. And we're done.